Hello. All right, next question is from Patty. I'm not sure which Patty, but I know a few of them. Yeah, hi. Okay, hello, Dr. Ben. Several of my friends have been chatting about this article. I'd like to get your thoughts on it. And we clicked through, and the article is called Are We Being Lied to About How Coronavirus is Spread? And so I had a look at the article, and what it's saying is that yeah, kind of what we've been saying all along, but kind of with a weird twist at the end. So from the point at which it first came out in preprint form, we've been saying that wow, it looks like some virus persists down in the intestines in a detectable form. You can find this by doing PCR, the normal virus discovery test on feces, basically. And so we've been saying that this is a really good test, and until you are negative, both in an oral swab or better yet, in a fecal test, because the virus persists there longer. Once you're negative both of those places, then yeah, you probably are virus free, at least to the extent that it's possible to confirm this. But I mean, remember, there have been people, for example, with Ebola, that years later there were little tiny dormant bits of it. One case in a person's eyeball, in another case they're not sure exactly where it was. But the virus can sometimes hang out. Certain viruses, anyway, can hang out in areas and keep replicating even after you thought they were gone. So the idea behind this is that some parts of the body are what they call immunologically privileged. Yeah, which just means to say that your immune system doesn't patrol them the way it does with other parts. And so if a virus gets into one of these sort of safe spaces, then if it can persist for a long time, and it can be very difficult to get it out. Now, does SARS coronavirus do this? We don't know. Yeah, so people are still very much learning about this virus. There are some that it works for. There's some that it doesn't seem to happen as much with. Depends where the virus can get in, how readily it can get into some of these tissues. Yeah. Anyway, the crux of the article is that we know there's a lot of virus that is in feces, and so the intestines are full of virus, and it seems to be there even after it's gone from your lungs, or at least not detectable easily from your lungs. And so should we be thinking in terms of fecal to oral spread, like that the virus in intestines is a potential source of risk? And this is something that, some scientists have been looking at. I think we've talked about it in a couple of videos. There is a high amount of virus detectable in the bathroom associated with a COVID patient's bedroom. So there's not that much in the bedroom, but in the bathroom, yeah, there's a lot of little pieces of it. The detection is based on finding a little part of it and then saying, yeah, the virus is definitely here in some form. Now, the confounding thing that we covered to some extent before, but what the heck, yeah, is that bile salts, so some of these chemicals that are made just as part of digestion, are really, really harsh on the virus. And so, yes, you can detect parts of the virus, but still, at least as far as I'm aware, I don't think anybody has recovered this virus in working order from an intestine. So it's there, and theoretically, as long as it's there is a way, and some virus particle could potentially get through, and so yeah, that's worth thinking about. I always wear one of these when I wear it when I'm inside anywhere that's not like an office with a door that's shut. Yeah, but yeah, especially bathrooms. That was like the first big consideration in any kind of road trip for work, was like, how are you going to go to the bathroom safely? Knowing that there's tons of the virus that comes out if somebody was sick, and a lot of people have been using a public restroom. Yeah, yeah. So it's a thing that so far seems kind of worrying, but also seems like there's not a lot of evidence that it actually translates to cases. At some point, there may be, and at that point, we'll pay attention, and we'll have to take maybe additional precautions. But if you're wearing a mask while you're going to the bathroom, that's the precaution you would take essentially. So just wear your mask. It's not bad. Yeah. Um, but yeah, that's the idea. So there are sort of apocryphal reports. There's the Amoy Gardens case from SARS coronavirus 1, where it seems like spread through water pipes hooked up to toilets is one of the theories that could explain why all the people that were in apartments that were on top of each other, hotel rooms, sorry, on top of each other, got infected and the rest of the hotel didn't. There are potentially other explanations that involve respiratory droplets, but all those are maybe a little more far-fetched. And ultimately, you can't go back and figure out exactly where a person got the virus in most cases. Since most of the virus that would be spreading around right now would be genetically either identical or so close to identical, it would be difficult to tell apart. All you can tell is whether somebody has the virus or does not have the virus. And if they have the virus, then they need to be, they need to take precautions, and it'd be nice if somebody's taking care of them. So there we go. I don't think we're being lied to, but I don't know that everybody's paying attention to that aspect, and calling attention to it is perfectly fine because it's solid science, and it's important not to let our guard down, and this might sort of help in that way. Just sort of, even though you're in the bathroom and it seems like it's just you in there, which is good, there is still the potential, and so you should still have that mask on. That's the idea. Yeah. So thanks very much. This is Ask Dr. Ben.